No more being in the dark about any issue that women experience. As long as I'm here, we're going to debunk them all and teach about them all. Okay, good. Hey there, welcome to my channel, Bingo It's Kimbo. I'm Kim, also known as Dr. GoodtoAll to some, and this is a safe place to learn about and celebrate being a woman. If you haven't already, go ahead and click that subscribe button to join the Bingo Babe family. This week, we'll be discussing a very common and unfortunately dreadful condition that women experience, and men too, but more commonly women: urinary tract infections, also known as UTIs. This topic was so highly requested, I thought it was only right that I ended Women's Health Month 2020 with it. Before diving into urinary tract infections, you know my style, always trying to show you guys the anatomy so that we all have a clear understanding, because we're learning, okay? And we're going to teach our children, teach our friends, teach our relatives. So yes, we've discussed the vagina, the cervix, and the uterus quite a bit on my channel. Now, as you know, this is the vagina. In front of the female reproductive tract is a urinary bladder. And to orient you a bit, here is the uterus, here is the cervix, here is the vagina. And in front of the vagina is the urethra. This is the tube that urine passes through from the urinary bladder, the urethra, and out of the body. Now, behind the vagina and the uterus is the rectum. And then from the rectum, where feces is passed through and stores, is the anus. In between the vagina and the anus is the perineum. So bladder, uterus, rectum, and the openings of these things are the anus, vagina, and urethra. Excellent. Now that we got that covered, let's dive right into UTIs. What are they? Well, the name pretty much explains the condition. It is an infection of the urinary tract. Urinary tract infections can be divided into two types of infections. You have the infections of the lower urinary tract, which consist of the bladder and the urethra, known as a cystitis. Then you can have an infection of the upper urinary tract, which consists of the kidneys and the ureters, known as a pyelonephritis. And the pyelonephritis is the more serious of the two, and what we don't want is the cystitis spreading up into the kidney, causing a pyelonephritis, because then we have a lot more complications with that particular infection. In this video, we're going to be really talking about the cystitis and teaching you everything, the causes, the risk factors, tips. You know how I do, so let's get into it. How does this infection occur? Simply due to the colonization of organisms that don't belong in the urinary tract. These organisms predominantly come from fecal flora from the anus or vaginal flora from the vagina, since the urethra is so close to both of those things. The main organism that is responsible for this infection is an organism that is known to be in the digestive tract called E. coli. This pesky organism causes grief, strife, and a whole leap of trial and tribulation when it finds its way in the urinary tract. This is not the only organism that can infect the tract, it is just the most common organism. Other organisms include other types of bacteria, viruses such as herpes virus, as well as even fungi such as the candida fungus, which is found in the vagina. There are quite a bit of symptoms associated with urinary tract infection, some of them which are specific to a UTI, which include: number one, frequent urination. Now, having to go to the bathroom more in the day and even in the night is a sign that you may have an infection in the urinary bladder or some form of irritation in the urethra. Two, the urge to urinate but not actually having to, and even if you do, it's a little bit, but it felt like your bladder was completely full, and this is because the bladder is irritated, so anything inside just needs to come out immediately according to the bladder. Three, burning in the urethra, especially during and after using the bathroom. And remember, the urethra is the tube that the urine passes through from the urinary bladder. 4, contracting of the urethra after using the bathroom. So you would literally feel a squeezing feeling in the region of the urethra after urine is finished. 5, bloody, cloudy, or even dark urine is an indication of an infection. Which brings us to point number 6. Foul smelling urine is usually an indication of an infection. And urine doesn't have a foul smell. It has a smell, but if it smells foul or not like your normal urine, there's something going on there. 7, abdominal or pelvic pain. Now this can be during urination or just without, but knowing that it's a urinary tract infection, it's usually associated with the other symptoms that we just spoke about. If there's no other symptoms there and you have abdominal pain, you may need further workup in addition to a history and all that good stuff to determine if it's really a urinary tract infection. But if you have abdominal pain, plus have to use the bathroom frequently or urgently, then you know that this is definitely a urinary tract infection. 8, back pain. Now if you have back pain, plus these symptoms that we were just talking about, you need to go to the doctor, because that is an indication that the infection is no longer in the lower tract but in the upper tract, such as the kidney, and an infection of the kidney is nothing to play around with. So if you're watching this right now and you have a urinary tract infection or symptoms of a urinary tract infection, and all of a sudden the left side of your back, your lower back, starts to hurt you and has been hurting you, pause the video and go to the doctor. Great. And lastly, symptoms and signs of an infection, which include nausea, vomiting, chills, and fever, just to name a few. Alrighty, let's dive into risk factors and some tips that I have for you to minimize the risk associated with the factor. Number 1, being a female. Now, women are beautifully and wonderfully constructed, crafted, and made. You know what I mean? I say, like, we're amazing. However, because of the proximity of the urethra to the vagina and the anus, there's an increased risk of organisms that are in those parts to get inside the urethra. In other words, what's at the back sometimes finds its way to the front. Of course, urinary tract infections can happen in men. However, their urethra, or the opening of their urethra rather, is at the tip of their penis, which is not right beside the nether regions, okay? So their risk is not as high as a risk for women. The tip I have to minimize that risk is always, I mean always, wipe from front to back. Let me show you again on there.
Front to back.
Please, I beg you. Risk number 2, decreased water intake. One of the functions of the urine is to flush the urethra. Now, if there's a decreased amount of water, there is a decreased amount of urine production. It is also more concentrated with all the toxins that the body is trying to flush out through the urine. This results in any bacteria or any organism getting inside of the urethra not being flushed out properly, because there's less urine that's more concentrated. Now that bacteria, as a result, starts to just be fruitful and multiply in the good urethra, causing all sorts of strife and complications. Just imagine trying to wash oil out of a straw with running water that is at a very low pressure. You're not going to be very successful getting all that oil out of the straw. However, if you turn up the water now and wash out the something, it will be clean, right? That's the same thing with the amount of water that you intake. The tip I have for you is, number 1, increase the amount of water that you intake. That's a minimum of 8 glasses of water a day. And number 2, do not, I repeat, do not hold your urine. Your job, your time frame, your nothing is worth getting a urinary tract infection and putting your kidney and the rest of your body or your bladder at risk of being infected. So go to the bathroom. And I mean, honestly, I really need to listen to this advice, because when I'm at work, oh boy, I don't go to the bathroom, and I really need to change that because I do not want to get a urinary tract infection. Risk factor number 3, sexual activity. Now, sex can be very irritating to the urethra, and with irritation comes inflammation. So not only is there inflammation, which predisposes any part of the body to infection, but there's also a thrusting of organisms from the vagina into the urethra, resulting in an infection. I must note that there's actually a 60% risk increase of developing a urinary tract infection after engaging in sex. So therefore, every time you have sex, there is a risk of getting a urinary tract infection. But have no fear, there are some tips that I have for you. Tip number 1, after sex, always urinate. 2, wash your hands and your genitalia prior to engaging in sexual activity. Number 3, and this tip is not only for urinary tract infections, for any infections, yeast infections, bacterial vaginosis, or anything at all to deal with the vaginal area, avoid using spermicides or flavored anything, either it be condoms or objects. Just avoid it completely. And tip number 4, minimize the amount of sexual partners that you have. Everybody carries their own flora of bacteria, and the more you expose yourself to different floras is the increased risk you have of developing an infection, in addition to the already risk that is there from having sexual intercourse, period. The 4th risk factor is inappropriate hygiene. And I mean, the tip for that is bathe, clean up down there, you know, fresh. And not just bathe properly. And I'm going to do a video. Alright, say you come across any of these risk factors, or even any of these symptoms that we just spoke about. What next? What do you do? Well, first step is go to the doctor. Go to the doctor, honey. This doctor's visit usually consists of a full history and examination, as well as a urine test, which will help determine whether or not there are cells in the urine that indicate an infection is present. If there are infection cells in the urine, then a culture can be done on the urine to determine what organisms are causing the infection. And then you can get appropriate antibiotic or medication for the organism that is causing the infection. So that brings us to treatment and remedies. Now, number 1, you guys know me, lifestyle modification is key all the time, and we discussed the tips already that help to change your lifestyle to prevent the risk of getting a urinary tract infection. So we won't go back on that topic. 2, medical management, and as discussed before, this is based on the urine culture and even the history that is taken to determine which medication is best for you, either via antibiotic, or antiviral, or antifungal. Whichever medication your doctor gives you, I encourage you, I insist that you take it as prescribed. Don't take 1 or 2 and now you don't have to go to the bathroom urgently, so you stop taking it. No, no, no. And that's so it works. You have to take all of the medication, and this will prevent the bacteria from spreading from the bladder up into the kidneys. And as I said, if nothing reaching out your kidney, it's a problem. You don't want that. Number 3, natural remedies. Now, I know everybody won't hear about this one. The tips I'm going to share with you can minimize the risk of getting an infection, number 1, and number 2, alleviate the symptoms, but really and truly treating the issue requires proper workup to minimize further damage to any other organ in the body. So, as you wait to go to your doctor, or you wait for the antibiotics or medicine to kick in, there are 2 things you can do. First remedy is chugging about 2 liters of water one time. And what happens is this thing called diuresis, where your body releases a lot of urine at one time. And remember what I said about turn on the pipe high to flush out? Yeah, man. You flush out the urethra, which can provide temporary relief while you wait for the antibiotics to kick in or the pain medications to kick in. Ensure, however, as soon as you feel the urge to go after doing this, you go. And try to do this every 4 to 6 hours, which would really help alleviate the symptoms. The second thing you can do is create an acidic environment of your urine. This can be done through cranberry juice, vitamin C supplements, or any form of vitamin C, either be citric fruits or supplements, right? And you intake this alongside the water to acidify your urine so that the acid can break up the bacteria or the affecting organism and help to fight it off while you wait for treatment to work. I'm telling you, if you combine these two remedies of drinking tons of water plus acidifying the urine, you are hitting the UTI with a double whammy, and you have conquered this battle and you're good to go. All right, so you guys can let me know if this remedy works for you. Share it. I'm telling you, it is holy grail. And that brings us to the end of this video. I hope you guys really enjoyed this video as much as I enjoyed creating it. Don't forget to like, comment, share with a relative, friend, your auntie, your cousin, your co-worker, and subscribe. By the way, thank you guys so much for 3,000 subscribers. I am so happy. Thank you so much. I appreciate you. You guys are awesome. Let's see if we can make it to 5K. Oh yes, almost forgot. I won't be seeing you guys next week. The time has come for my annual mental health break. No social media, minimal contact with others other than work, of course, but I really need to replenish, go inside and weed out anything that may have grown over the period of time since my last mental break. I really love me time. It's so sacred and so amazing. I love the woman that I am, and anytime I get to spend time with her is a wonderful time. But every year, as some of you may know, I take an extensive amount of time to just focus on me and my growth so that I can come back fresh and pour into you guys and be optimal at work and be able to function with my family. It's just something that I think is so beautiful to do. So if you're even interested in this whole social media break, you guys can send me a message on how it goes and what I do, and I'll be more than willing to answer. Until then, stay beautiful, binge watch my videos, there's a ton, and I'll see you soon. Bye.